Hey everyone, I'm Dr. Mansi from Homeopathy 362. Our very brilliant speaker from Tamil Nadu, that is Dr. Santhosh Kumar. He is a gold medalist in MD Homeopathy, and also he's pursuing PhD in Homeopathy in Tantia University from Rajasthan. And I would like to share that he is assistant professor of organon from Homeopathic Medical College, that is in Excel Homeopathic Medical College. Also, he has a clinical experience. Also, he has worked as medical officers in Isha Foundation, and he has also worked in a regional clinic and consultant at Madras for more than 4 years. So now he's going to present a webinar on the topic role of Miasm in autoimmune disease. As all we know, how much autoimmune disease are increasing day by day, and these diseases are too difficult to handle. But today we have Dr. Santhosh Kumar. He's going to give you a brief of autoimmune disease and how you can crack the code to manage the case homeopathically. So now let's begin with him. Sir, please begin your presentation.
Yeah. Thank you so much. Thank you, Dr. Mansi. Thanks for all the listeners. Thanks for your patience. First of all, so I am Dr. Santhosh Kumar, assistant professor, working in a Excel Homeopathy Medical College, assistant professor in Organ of Medicine. Can you go to the next slide, please? Second one, the very second slide, the previous one. Miasm in the treatment of the autoimmune diseases. So you can see in the bottom of the slide, this is the college. This is my college where I'm working currently. So now, okay, it's a very nice ambience, very good infrastructure. Excel Homeopathy Medical College, where I'm working as assistant professor right now. So let us, I must thank all the, patients for your, all the listeners. Thank you so much for your kind patience. Let's go to the session now. Okay, next slide. Please change the slide, ma'am. Next one. Yeah. So my sincere thanks to my beloved principal sir, principal cum medical superintendent, Dr. T. Saravanan. He's a great, supporter, and with the best wishes from our principal sir. So he's a very good human being, and with the moral support, he's actually, apart from everything, he's a great mentor, and he is being a very great strength for our institution. So with the guidance of our principal sir, I prepared the slides, and with the guidance under the guidance of my principal, so I got a lot of very important vital data. I prepared all these slides. Okay, let's go to the session proper. Okay, so today the topic is the role of miasm. Let's see what is a miasm. What is a miasm? Two elements are there. What is a miasm and what is a autoimmune disease? As you know very well, so autoimmunity. What is autoimmunity? Autoimmunity is a misdirected immune response. Nothing but misdirected. Our immune system works against our own body and works against our own cells of the body. Dr. Mansi, don't change the slide. The previous one. Can you please kindly go to the previous slide, ma'am? Am I audible? Can I see something in the chat box?
Yes, sir. You are audible, sir.
Ma'am. Can you go to the previous slide, ma'am? I think there is a little delay in that, previous one, ma'am, not the next one, previous one, the last slide, the introduction. Let me continue the introduction. So the autoimmunity is the misdirected immune response. So there is a two type of responses. We can see there are two types of autoimmune diseases. Basically, this is about the medicine part. One is the organ specific, another one system specific. You can see in that bracket two types, and the prevalence of the autoimmune diseases I have mentioned in the slide. You can see over 80 recognized. There are a lot of the autoimmune diseases. Among those diseases, 80 well recognized autoimmune diseases affect millions of the people in the world. And there is a lot of limitations. Let's see the limitations. Conventional treatment. Under the convention, in the day-to-day practice, we can see many patients, they are approaching us, knocking the doors of the homeopathy doctors, homeopathy clinics for the best treatment and for the harmless, side effect free treatment. Limitations, let's discuss, analyze the scope and limitations of the homeopathy when it comes to the autoimmune diseases. See, I have seen in my practice, people used to come, they are very happy with the symptoms aspects, but later on, slowly after taking the allopathic medicines, they started experiencing the discomfort and many adverse effects of those medications. To control those adverse effects, definitely, they must be having some other alternate option. Apart from all those things, they have lot of limitations. I'm talking about the conventional treatment, allopathic medications. Nothing but they have only immunosuppressants and immune modulators, those things having lot of side effects. Okay, so what we can do in those cases, how we are going to connect the autoimmunity with the miasms. Let's go to the core of the session. Can you change the slide, ma'am? Next slide. Romancy. Can you change the slide, ma'am? Lavanya?
Yes, sir. Actually, the slide is being changed, sir, for you due to the network
Okay.
issue.
Okay, fine. Let it be. Okay, there is a small delay in that, this thing. Okay, no issue. So what is the next slide? You can see there is a triggers. You can see the triggers. Under the triggers, physical and mental triggers. So can you see the picture I have kept in this slide? What is it? Can you tell me? Can somebody? I want the session to be little interactive. What is that picture you can see in that slide? Can you tell me that? Can you keep the slide of triggers? I want the trigger slide need to be displayed.
Yes, sir. It is.
Hi.
It is triggers PPT, and
Yes.
as we can all see, there is a picture. I think it's a iceberg.
Wonderful. Excellent. So thank you so much, Dr. Mansi, for your response. So this is the iceberg. Why I kept this picture here, what we can see while sailing the boat or in the ship, we can see only the tip of the ice. We can see only the tip of the iceberg. So that is what the symptoms we can see in the patient during the first consultation. What we cannot see, which part of the iceberg is hidden completely, is the bottom of the iceberg. That is a complete foundation. Those part, that part is very important. That is a invisible part for a homeopathy physician that need to be explored. Why I'm quoting this iceberg is a best example when it comes to the community medicine. So this example being quoted to explain the symptomatic and the non-symptomatic asymptomatic cases actually. But here I'm taking this example to make you understand, dear listeners, please try to understand this iceberg phenomena here. What we can see, the tip of the iceberg is the symptoms available in the patient. What we cannot see is symptoms hidden in that patient. That symptom need to be explored. That symptom need to be probed. Those symptoms need to be well managed, taken into the account. with the help of the visible symptom, with the help of the invisible symptom, we have to construct the complete totality. So here you can see the triggers, physical and mental triggers. Physical triggers, physical factors, bacteria, virus, chemical irritants, drugs, environmental irritants. And when it comes to the mental part, strong, long-lasting emotions. That is, see, I want to quote here, I want to mention about the H.A. Roberts' important chapter, Obstacles to Cure. Hope definitely everyone must have studied. This is the small reminder for all the listeners, especially for the listeners, those who are coming from the student section. You can please recall the chapter number, if I'm not wrong, chapter number 11, that is a deflected current from H.A. Roberts. So the obstacles from the patient side, there are three obstacles. One is from the physician side, another is from the medicinal side, third is from the patient side. So mental symptoms, strong, long-lasting emotions, that is a very big obstacle when it comes to the chronic diseases, especially in the autoimmune diseases. We can see that autoimmune element, so that is getting triggered because of the suppressed emotions, or because of some mental trauma, very bad incidents, negative emotions, negative the kind of feelings triggered by the disappointments or loss of loved ones, anything, okay, that also can trigger the autoimmunity. I am trying to connect the autoimmune part with the miasm. See, a background miasm, keep it in your mind always, we should have the conscious of the miasm. So because of these triggers, any miasm can get triggered. Okay, so that miasm going to play a very major role in the autoimmune diseases. I am not talking about the other diseases. When it comes to the classification of Hahnemann, disease classification of the Hahnemann, we can consider the only we are talking about the true chronic diseases, true miasmatic diseases. In that true chronic miasmatic diseases, how to work out the miasm, how to catch the root of the autoimmune disorders. Can you go to the next slide, ma'am? Thank you. Wonderful. So this is the main essence. This is the important part of this discussion. Miasm and disease susceptibility. You all know very well. You know about the miasm. What are the types of the miasm? What is the so there are range of explanation, varieties of explanation about the miasm. From many readers, for many authors and lectures, and you can see many stalwarts. They given their personal opinion about the miasm. Let's discuss dissect this miasm from the Hahnemannian part. Okay, it is an invisible matter. It is an invisible moving matter. Okay, so let's see what kind of miasm, how this is going to make a person susceptible, how a particular person going to become, he is going to become a vulnerable for the particular disease, how this miasm playing in the background, how he is getting triggered by those physical and mental factors. It is a very important area need to be analyzed. Okay, this is the debatable part also, and the same time lot of researchers needed in this part, and this miasm need to be explored well with the clinical trials. So here a small discussion, you can see miasm is a predisposition. We know very well predisposition. That is the reason why we are taking all the past history, family history, and past medical history and personal history, everything. So with the help of all those data, we can come to the conclusion. We can work out the data, the symptom data from the patient side, and we can come to the final part of the miasmatic analysis. Disease susceptibility is nothing but the miasm. So everyone on earth definitely must be having a miasm. No man is possible without miasm. It is a very great quote from the Hahnemannian side. And when you read the lectures of the Kent, Dr. Kent's lectures, philosophy, homeopathic philosophy, you can see miasm is one of the major part. Okay, need to be. It is a spiritual sickness. According to Kent, the miasm, the sora, is a spiritual sickness. He is calling, and he is giving the different name for each and every miasm. So there is any disease, not only the autoimmune disease, any disease you take, there are three phases. Slowly they develop. First the subclinical part and the clinical part, and the full-fledged, completely established disease condition. So that is the destructive part. It depends the patient, it depends the age, and depends the lifestyle they are going through, and what kind of morals they are following in their life. Soric phase, psychotic phase, syphilitic phase, and the weakness. See, soric phase, I just given the example. It is a small keyword. Each and every miasm has its own keyword. Okay, weakness and kind of, it is a kind of functional disorders. When it comes to the psychotic thing, we can see the chronic inflammation, the swelling, and the growth, whatever the hypertrophy, all these things connected with the psychotic phase. And the third phase, when it comes to the syphilitic condition, we can see the complete destruction. Not all the autoimmune diseases comes under the syphilitic phase. Not all the autoimmune diseases shows the syphilitic phase at the beginning itself. We should not get confused with the autoimmunity with the syphilitic. Okay, definitely each and every, I have, in my clinical practice, I have seen so many psoriatic cases, vitiligo cases. They are doing very well. They are going very normal with their routine without any complication. Here and there, very few patches they must be having, but there is no major health issues in their lifestyle, in their body or mind. Okay, that is a psoric phase. When it comes to the psychotic phase, simply how a person getting transformed, transformed from the psoric to psychotic, syphilitic need to be discussed, need to be analyzed. This is a very important part, need to be focused, because of the suppression of the wrong intervention of the allopathic medicines or anything. Not only, I'm not blaming any system. I'm not here to blame any system, but how it is getting suppressed. Even emotional suppression is also a suppression. Suppression is a suppression, so it can take place in any form. Okay, so especially, but in this current trend, we can see they used to take a lot of because when it comes to the disfigurement, for example, you take the vitiligo cases. Vitiligo, if they have the patches on the face or hands and the palms or some other parts of the body, in the exposed part of the body, definitely they they will try to hide that patches in the body. If it is a psoriatic patch on the face or scalp or behind the ears, definitely they'll use some external applications. So because of that, it gets suppressed, and slowly they go to the next stage and the next stage. So all the suppressions pushes the miasm from one stage to another stage. Definitely they'll get more complication. That is a complication. The other name for that complication is that is a sequel of the disease. That is a secondary sequel. That is a secondary effects of that suppression. Okay, let's go to the next slide. I think I am a little bit fast. I know if you have any question or clarification, please stop me in that particular point. Let me clarify that, whatever the doubts you have. Dr. Mansi, can you go to the next slide, ma'am?
Yes, sir. Slide is changed.
Yeah, next slide is about the shift in the Hahnemann's practice. You can see before I have mentioned here, you can see here the shift in the Hahnemann's practice. If you read the Hahnemann's, chronic diseases by Hahnemann, the lesser readings of the Hahnemann, you can see completely the practice clinical cases treated by Hahnemann before 1796. That is a year he made a lot of changes. If you go back to the 1796, you can see the prescription of the Hahnemann is totally different. After 1796, you can see a great paradigm shift in the practice and his prescription. The great changes happened in his totality, because why you know that lot of patients treated by Hahnemann started getting the relapses and recurrences. Okay, even though the remedy is very correct, even though the totality is perfectly formed, the medicine given perfectly, still the patients started getting many recurrences. To clear the recurrences, Hahnemann started working on the totality of the symptoms. He started thinking, he completely worked out all the whole cases. He has done the anamnesis, and he found that is a point where he discovered the part of miasm, theory of miasm. After the 1796, he started working out the cases very deeply. Why that particular patient, person keep on getting the same issues again and again. He worked out the cases. Then he find there is a predisposition, there is a greater groove for the particular disease. There is a strong root in that person. With the root must be cleared. The second aphorism says The cure must be rapid and gentle and permanent. What are the three key words from the second aphorism? Rapid, and it must be gentle, and it must be permanent. Okay, how? When it comes to the permanent, definitely the restoration of the health is important from the root level, from the foundation of the body and mind. So he worked out the cases. He started including the very strong, deep rubrics. Based on that symptoms, he just categorized the remedies also into anti-miasmatic remedies, antipsoric, antipsychotic, and antisyphilitic remedies. Then he just given those remedies. Then he started finding the recurrences has come down, relapses come down, and there is no recurrences. Then the patients were very happy, and they were, for a long time, reasonably for a long time. Okay, there was no recurrences. This is the very important part we must, notice. We should observe, we should learn from the Hahnemann's practice. Can you go to the next slide, ma'am? Okay, what is the next slide? Here the mechanism, you can see imbalanced immune response and chronic inflammation. Miasm gets triggered by the many environmental factors. Chronic inflammation, you can see in the previous slide only, we have seen that thing. Wherever you see the chronic inflammation, chronic, any kind of indurations, all those things, that is because of the background of the miasm. Environmental factors like stress, toxins, infections, those who are living in a damp house, or working, staying in a industrial polluted areas. Okay, any trigger, anything can trigger, anything can stimulate, anything can stimulate the background miasm. Okay, because of those things, the inherent, miasmatic influences, come to the surface. Then it started acting, it started establishing the real disease. That is a point the person become more vulnerable, more susceptible. The word susceptibility is very, very, very important. So that is a point they develop, they receive all the infections, they just produces all the symptoms. Okay, and apart from that, genetic predisposition also very, very important. Everybody, we all definitely, we must be having a predisposition from the gene level. That is a very modern terminology. We are in the homeopathy terminology, we can use the word the miasm and the predisposition, vulnerability. Okay, these are all the this thing. Okay, susceptibility. Miasm is increasing the susceptibility to autoimmune diseases. Here I want to connect the autoimmunity with the miasm. We can see that, specific keywords for each and every diseases. Autoimmune is nothing but the self-destructive phenomena, or self-attacking, or kind of a self-harming, self-injury. Wherever you can find these things, definitely we should catch the autoimmune diseases. We should suspect the autoimmune diseases. Okay, let's go to the next slide. Okay, so here comes the very important part of a presentation. PNEI axis. So psycho, neuro, endocrino, immunological aspects. Here you can see whatever the impact happened in you can see this thing, in a H.A. Roberts' philosophy, even in a Stuart Close's philosophy also, you can see PNEA axis. It is very perfectly explained by the H.A. Roberts. So whatever the impact, whatever the problems happened in the psychological level, it creates a chain of reaction. It gets conducted, transmitted to the neurological aspects, then slowly gets conducted to the endocrinology aspects, then slowly it reaches the immune aspects, immunological element in the body. So whatever the impact happened, whatever the problem, injuries or damages happened in the psychology, for example, it is a mind aspect. It is completely mind and emotions and sensations. When a person gets hurt in the psychological aspects, definitely it creates it is a sequel, it is a chain of reactions. It gets transmitted to the next level. Finally it reaches the immunity. It affects it suppresses the immune aspects, immunity of a person. Automatically, this is the thing here, we can understand, based on this we can understand the concomitant symptoms. We cannot see the well established connection between two symptoms. Okay, so there is no direct pathological reasons, there is no direct pathological or scientific connection between those two symptoms. That is actually because of this PNEI axis only. So these axes need to be well understood by each and every homeopathy physician and each and every homeopathy student and each and every person who involved in this homeopathy community. So then only easily we can treat all the autoimmune diseases perfectly. Why that person's immunity acting against his own body is to be well understood. It is nothing but misdirected. What makes the immunity misdirect, what makes the person, what makes that immunity to act against on his own body, that is a part we have to need to be probed and need to be understood. What happened in that part, what is the confusion in the immune level, what happened. So that is the part where we have to work out. We have to do a small analysis and a deep research also. Then only we can enter into that. Otherwise autoimmune diseases a little difficult to cure, little difficult to treat, and very difficult to satisfy those patients because their mentality and their behavior, their pattern of actions, everything will be different from the other patients. But definitely we can find. Let me explain in the next session. Next slide. Dr. Mansi, can you change the slide? I don't know who is operating. Oh, thank you. Yeah. Okay. Intervention is one of the very important point here. How we can intervene, many ways we can intervene these kind of cases. One is by suppressing the person's immunity. Another way we can improving the immunity of such a persons. Once if you suppress the immunity, definitely they are going to get lot of health issues and other systems. Definitely by suppressing the immunity, we are making the person more vulnerable for the opportunistic infections. See, once you cut off the immunity, once you keep the immunity in the mute, once you mute the immunity, that person is exposed to, because now we are not living in a very clean, pure, sterile environment. We are living in a very polluted places. So wherever you go, pollution follows you. Wherever you go, kind of contamination in the water and adulteration in the food. And apart from the physical factors, as we discussed about the mental factors, wherever we go, this kind of disappointments or other kind of stress, pressures is there everywhere. So definitely it is going to affect you. It is going to interact with your immune system. So it is not good to suppress the immunity. Here the point I want to convey is to enhance, to bring the stability, to work out that stability. What is the problem happened in the emotions of that person, where he is doing, where he is becoming completely unstable. So that is a point, that is a hard spot of the case. We have to catch that hard spot and we need to fix that area. Then only it is possible. There may be problems in their understanding or interpretation or in the cognition level. That is the point where we have to work out. And by correcting that, by troubleshooting that area, definitely we can fix the immune of the particular person. So we have to individualize the case. At the same time, we have to intervene with the right time and the right medicine. So the time is also important and the right medicine also important. Then only we can expect the good improvement in those cases. So restoring the balance and the harmony, supporting the immune system's function, reducing the frequency and the intensity of the autoimmune flare-ups. In the psoriatic cases, we can see a lot of flare-ups, acute flare-ups. They get emotionally very badly disturbed. So it is very difficult. I have seen cases. I have seen the patients in my clinic. I worked in the corporate sites and in my own clinics also. Simply they'll come and they'll shout, they'll bang your doors. If we fail to show the improvement, definitely we get a lot of troubles from the patient side. So better we should not play. We should not we should not waste the time of the patient. In the right time, we have to work out the cases. We have to show the right improvement at the right time. Otherwise, definitely we cannot retain the patient. So this is the opinion suggestions from my side to the practitioners, those who are in this coming in the webinar. So autoimmune diseases are little critical and sensitive, need to be handled very carefully. If we fail to if you fail to recognize or difficult to manage, if you feel it is difficult to manage such a cases, please forward, refer those cases to your seniors, those who are having a very good expert in that particular disease section. Please get the opinion from your seniors. experienced physicians, then you treat the cases. This is my kind advice to all the practitioners, especially those who are in the beginning stage. Can you go to the next slide, ma'am? Identification. So this is another important part. Identification is very, very important, where you can see the identification is always there is a correlation between the mind and body. You see the symptoms. So in few cases, we don't get the symptoms from the physical side, body, physical symptoms. Mental symptoms sometimes may not be available in some cases. In those cases, if it is partially available, we can correlate the complete mental symptoms with the physical symptoms. There must be a correlation. Whatever is there in the mind is a index of the person. Okay, so here you can see, and the mind and body speaks the same language. Based on these things, we can we have to analyze the cases, and the physical examination is important, and the family history is important to reach a conclusion about the given case. Okay, you can see the quote: a well taken case is half cured. Once you take the case in very detail, that itself is the 50% you cure the cases. Okay, so here you can see the symptom analysis important. Physical examination of the patient is very, very helpful. It's going to help you to fix the physical diagnosis of the disease. And the same time, family history is important to find out the fundamental and the dominant miasm, especially fundamental miasm. Okay, and when you go to the past history, you are going to catch the dominant miasm. What are the repeated infections, what kind of repeated problems that person had. So by working out all these data, we can come to the conclusion about the person's miasm. Can you go to the next slide, ma'am? So this is the treatment strategies. Just leave the option to the patient. Leave the option to the patient, whatever they feel comfortable. Let it be the homeopathy, or you just being a homeopathy doctor, we must explain. We have to explain the positive and the negative aspects of the conventional treatment, and the same time we have to explain the positive and negative aspects of the homeopathy treatment also. We have to accept our limitations, and we should be aware about our scope also the same time. And here you can see many patients, the patients whenever you are treating the autoimmune diseases, very critical cases, very sensitive cases, you should see the age of the patient, lifetime space of the patient, and the background of the patient. And the same time, Dr. Mansi, can you change the slide to the next this thing? That slide must be, I think, I don't know whether I'm following the right slide. Treatment strategy, homeopathy versus conventional. This same slide. Yeah, thank you. So understanding the patients. Yeah. Okay, so the previous slide is actually understanding the patient's miasm, selecting the remedies, and the dosage and potency also very, very important. And we have to educate the patient. We should empower the patient. We should enhance the knowledge of the patient. It hardly we have the time. See, always I used to do this thing in my clinic, during my yearly practice. I always, used to educate, explain the fundamentals of the homeopathy to the patient. Then only we can make the patient to stick onto the treatment. We can retain the patient only with the kind cooperation, exact, right cooperation of the patient only. We can treat the cases. Otherwise, it will become a very big obstacle from the patient side also. As we discussed, deflected current in the H.R. Roberts chapter. So the patient cooperation, they should be mentally completely free from the other notions, whatever the super beliefs, because nowadays patients are very smart. They used to come with a lot of information. They Google everything. They'll come up with the diagnosis and the lab investigation, everything they'll just come and explain. The only thing we need to explain about the real, what we are going to do with the patient. So patient can sense what we are doing with them. So we should not let them suffer at any point. Explain the scope and limitation of a particular case they are coming, that they are presenting with. So in that cases, what we can do, what we cannot do, what can be expected, what is not possible, all these things we have to explain to the patient. Then only it is possible we can get the complete cooperation from the patient. Sometimes we can treat the cases with homeopathy along with the allopathy medicines also. Slowly we should know how to taper those medicines also. Otherwise, it is not possible to handle the cases. Few cases it is very difficult to taper the medicines. Very slowly we have to reduce the medicines. Suddenly we cannot stop the medications because acute flare-ups very difficult to manage when it comes to the vitiligo, lichen planus, all these cases. Okay, very severe aggravations they used to get once they stop the medicine at a stage at a time. So it is to be understood that all those suppressants, all the allopathy medications, conventional treatment need to be handled very carefully, especially when it comes to the autoimmune diseases. It is another complicated area where we have to work out the case in the sufficient time. Then only it is possible to treat the patients. Dr. Mansi, can you go to the next slide? Okay, so here you can see the references and reference part, and okay, so these are all the very I am not able to accommodate all the data. Sorry for the inconvenience. I apologize for inconvenience happened from my side. So because of the poor network connection, I am not able to connect, and I am very new to this Zoho platform. That is the reason I could not get connected at the beginning itself. No, lot of technical difficulties we had. So definitely I hope, I must thank my college principal, Dr. T Saravanan sir, and the same time thanks for the opportunity you know uh, from the association, and each and every member, and the president, all those who are being a very big pillar for the association, and the technical team especially. I just trouble them a lot before connecting this uh, session, and I thank each and everyone, especially Dr. Mansi and Dr. Lavanya. She's the one who introduced me to this session. Thank you so much. Thank you. So if you have any questions, you can go to the next slide. There is a complete contact, my number, and you can see the mail ID also. You can keep in touch with me. You can write the queries to my mail ID.
That's totally fine, sir. And thank you so much for this wonderful webinar. I would like to thank the organization, that is ICA organization, and Homeopathy 360 for arranging this webinar, and Dr. Santhosh Kumar for the wonderful speaker. And, thank you so much, everyone. Thank you so much, all the viewers, for making this webinar very successful. And in the next webinar, we will meet soon with another topic and another informative, all the notes. Thank you so much. Good night.
Thank you all. Good night.